talking about neoplasms guidelines, and there are guidelines specifically for anemia and dehydration and others when a patient has cancer. All right, so when the anemia is associated with the malignancy, guideline C2.C1, that means the malignancy may have caused the anemia. If the documentation supports that, you're going to sequence first the malignancy, your C code, followed by your anemia, D63 or D6 something, an anemia code. Next, when you have anemia associated with chemo or immunotherapy, it is not the same as anemia associated with malignancy, but the chemo, the treatment, C62C2. The encounter, when that encounter is only for the treatment of the anemia caused by the chemo, you're going to sequence that anemia first, followed by the malignancy, followed by the adverse effect. You're going to use an adverse effect code. We have another anemia code. When the radiation therapy, when that radiotherapy causes the anemia, C2C2. When the encounter is only for the anemia caused by radiotherapy, the other two were chemo and immunotherapy. This is different, the radiotherapy. You're going to code first your anemia code, followed by the malignancy, and then third, radiotherapy. Next guideline, hopefully you're following along in your MCG manual, and feel free to kind of make notes that speak to you. Now we're going to switch gears and we're going to dehydration, C2, C3. This is management of dehydration due to malignancy, right? So if this encounter is because the patient is dehydrated and only the dehydration is being treated, you're going to sequence first your dehydration, get a code from the dehydration category, and then second, your malignancy. Now, if the treatment is for complication resulting from a surgical procedure, surgical procedure, C2, C4, you're going to sequence first your complication, whatever that complication is. Second, your T81.4, this is infection following a procedure if it's applicable. And third, your malignancy. And our last guideline that we're going to review, C2.D, primary malignancy that was previously excised. And if that primary malignancy was previously excised, and if that cancer is completely eradicated, I think we need to specify that. Treatment for the secondary cancer with a history of cancer previously excised. Let's say someone had breast cancer and they no longer have cancer, then this is how you code. Okay, let me just elaborate a little more. If someone has breast cancer, and that breast cancer metastasized into some other part of the body, but that person had a mastectomy, and the patient no longer has primary cancer, then you will sequence first your secondary cancer and second, personal history. Again, that cancer has to be completely eradicated before you can use this code, the Z85.3. So make sure your documentation supports that. All right. Now we've got a challenge. Yeah. I got one scenario, and then I'm going to hand it over to Mr. Sandeep, who's going to do his thing. All right, coders. Now, don't forget, this is how you solve a scenario. Make sure you highlight or inventory all of your diagnoses, signs, or symptoms. Identify your first listed code, and don't forget to apply all guidelines. Are you ready? All right, what is or are the correct ICD-10-CM codes for this encounter? A, D64.81, C79.81, and T45.1X5A. B, C50.929, D64.81, T45.1X5A. C, D64.81, C50.929, and D, D64.81, C50. The physician diagnoses the patient with anemia caused by the breast cancer. Chemotherapy treatment. The physician wrote the patient a prescription for iron tablets and administered a B12. Okay, coders, do your thing. This is where you can show what you've got, and I know you've got a lot. Your time begins now. Okay, coders, tell me, what guideline did you apply? Type in the chat, which guideline did you apply? You can say the number or you can say none. I want to know, did you apply a guideline? Good job. Good job. Those guidelines, they're going to help you every time. If you can identify the guideline, you can just kind of follow it. That's it. Just mimic it. All right, coders. Good deal. Outstanding. A lot of people said guideline. C2, C2, outstanding. So let's go ahead and highlight our keywords. We have male primary breast cancer, tiredness and fatigue, and the patient was diagnosed with anemia. The doctor said it would be treatment. All right. So here are my inventory: male primary breast cancer, tiredness, fatigue, anemia due to chemotherapy. I just wrote it. We might not need it. But my tip, don't forget to know the differences between these cancer as well as treatment. Treatment might not apply, but always be conscious of it. But it's not really applicable. If you just go grab this guideline, like many of you have, C2C2, go to the third column, it tells you how to sequence, right? So this C2C2 is the guideline for anemia associated with chemo. And you sequence your D30 or anemia related code. So it's one of those D codes, followed by the malignancy, followed by your adverse effects code T45.1X5. All right, so I'm looking over at my answers. Which one matches this? Okay, which one matches this sequencing order? Well, I can tell you off bat what doesn't match. B, because it's sequencing the cancer first. And C is not coding for an adverse effect code, so we can get rid of that too. All right, let's continue. All right, so we know that B is not sequencing correctly. It's sequencing the cancer, C50.929. Also, A is incorrect because it sequenced the wrong malignancy code. Look, coders, it's sequencing secondary cancer. This patient doesn't have any secondary cancer. You got to go 2. And C, you got your missing adverse effects code. And D, that's your answer. So let's do our due diligence. D64.8 category. This is other specified anemias. Go down to D64.81. Anemia due to anti-neoplastic chemotherapy. This is our code. And coders, look at this tap tip. If you put the sequencing you have to do when you take your exam is match the order. That anemia should be first, the malignancy should be second, and your adverse effect should be third. I'm going to let that marinate. Now I'm going to look at my, that was a quick marinate, right? All right, now I'm going to look at my malignant neoplasm of the breast of correct code, malignant neoplasm of unspecified site of unspecified male breast. And that's the answer. But we got one more code, this adverse effects, and you'll learn about adverse effects when we get to chapter, is this 19? Yeah, this chapter 19. I would also tap next to the adverse effects code. I would, because, and I would tap the sequencing order next to the adverse effects code right? Yeah, I think it's a quickie. I think it's a good tip. I do. All right. I'm breaking up again. Okay. Well, in good time. It says my mic is even getting worse. This is a brand new mic. All right, Mr. Sandeep, take it away, please, and thank you.
Thank you, Mrs. J.
Thanks for tuning in, and until next time, happy coding!